Good day. I'm Pauline Ashfield-Watt, and I'm the Research Manager at HealthWise Wales. I'd like to tell you about the COVID-19 research that HealthWise Wales has facilitated and demonstrate how HealthWise Wales may be able to support your research too. During this presentation, I'll tell you what HealthWise Wales is, explain how our consent to contact register has supported COVID-19 research, provide a snapshot of the COVID-19 research projects that we've supported, use examples from these projects to show the benefits of using HealthWise Wales for your research. And lastly, I'll provide information on how you can contact us or follow our work on social media. So what is HealthWise Wales? HealthWise Wales is an online research platform that is funded by the Welsh Government, led by researchers at Cardiff University, and supported by Clinical Trials Research and the SAIL team at Swansea University. HealthWise Wales has over 40,000 participants who receive their healthcare in Wales and have consented to be contacted for data collection and recruitment to research studies that might be of interest to them. All participants consent for their HealthWise Wales survey data to be linked to their routinely collected healthcare data. HealthWise Wales has its own data collection platform for collecting data that is not routinely available from other sources and hence augments the healthcare data that are available in the SAIL databank. To summarise, HealthWise Wales facilitates collaborative research by identifying potential participants for new research studies, collecting bespoke data at scale, and providing access to HealthWise Wales survey data and record-linked healthcare data via a secure data access portal. We began advertising opportunities to take part in COVID-19 research led by researchers in Wales and across the UK in March. The studies have largely focused on the impact of the pandemic on the public and have sought to collect data on beliefs, attitudes and behaviours. They have used a range of methods, including the development of virtual methods necessitated by the lockdown. By using HealthWise Wales specific links in our advertisements, researchers have been able to provide feedback on the numbers of HealthWise participants they recruit, and these are noted beside the study name on this slide. We currently estimate over 25,000 recruits from the HealthWise cohort to these advertised studies. Unfortunately, we're not able to account for the number of participants who have signed up to the UK-wide initiatives that we have promoted, such as the Zoe Symptom Tracker app and the recruitment of volunteers for COVID vaccine trials, hence the question mark at the bottom centre of this slide. To find out more about the COVID research we're supporting, please visit our COVID-19 research page on our website at www.healthwisewales.gov.wales/COVID-19. I'll use examples from a few of the projects we've advertised to demonstrate some benefits of using HealthWise for your research. I'll start by telling you about the COVID Cymru study. This was the first COVID-related study that we advertised, and it was set up in rapid response to the COVID pandemic, just before the lockdown came into force. The study was led by Rhiannon Phillips at Cardiff Metropolitan University in collaboration with colleagues at Cardiff University and Clinical Trials Research. Their aim was to recruit via social media and other networks across the UK, and HealthWise Wales was asked to advertise to our participants. This graph shows the progressive sign-up of HealthWise Wales participants over the recruitment period. So we have chronological date on the x-axis and number of recruits on the y-axis. Emails inviting HealthWise Wales participants to take part in the study were sent out over 5 days starting on Friday the 20th of March, indicated by the red box. Over that first weekend, 1,700 participants signed up, and within a week we had over 5,000 participants, a response rate of about 16%. A reminder included in one of our scheduled newsletters, distributed according to the green box, yielded a second recruitment spike, raising recruitment to 25%. Recruitment closed on the 12th of April with 8,730 participants signed up. This was a fantastic and unexpected response from our HealthWise participants at a time when there was so much uncertainty and change going on. To demonstrate the benefit of having a consent to contact register of research-ready participants, I'd like to share some process statistics from the COVID Cymru study with you. There were 3.5 times the number of HealthWise recruits compared to concurrent recruitment from other sources. Of those who took part in the baseline survey, 94% of HealthWise participants agreed to 3-month follow-up, compared to 75% of the social media cohort. Of those who signed up for follow-up, 78% of HealthWise Wales participants took part at 3 months, compared to only 62% from the social media cohort. This means that of those recruited via social media, a much smaller proportion of baseline respondents actually took part at follow-up, 46% versus 73% of HealthWise participants. 84% of HealthWise participants provided consent for the data that they provided to the COPE study to be linked to their HealthWise Wales and healthcare data. I've shown you some of the process statistics for the COVID Cymru study to demonstrate the rapid response to the pandemic that we were able to facilitate and the commitment of our participants to COVID-19 research. So what happened next? On the basis of the baseline data and the strength of supporting data sets, including the ability to link opinion and behavioural data to healthcare records and the potential for follow-up, the research group were able to achieve funding from the Welsh Government Sir Cymru Tackling COVID-19 call. This funding supports further data collection at 12 months and the analysis of all 3 rounds of data collection. It is anticipated that these data will provide health policy makers and planners in Wales with rapid, novel and locally relevant data to inform the ongoing response to the current pandemic and to provide data that will support other research bids, including international collaboration. The second study that I would like to highlight was conducted by researchers at Swansea University and led by Professor Karina Jones and Dr. Rachel Thompson. This study required a smaller sample to firstly carry out a survey about public opinion on contact tracing and to use the survey as a basis for conducting a public deliberation activity. We invited 4,000 participants, oversampling men and BAME, and we had a 24% response rate with an almost even proportions of males and females. We know that males are often underrepresented in health surveys. 4.5% of respondents were from BAME communities, compared to less than 2% of BAME across our cohort and indeed across Wales. So by oversampling, we widened the opportunity for BAME voices to be heard. This work led to the development of online methods for facilitating timely public deliberation on policy-relevant issues. These are just 2 examples of the research relevant to the people of Wales that we have supported. As I mentioned earlier, further details of other studies we've supported are on the COVID-19 page of our website. I'll just briefly share with you a third example which shows recruitment of HealthWise Wales participants to UK-wide research. This study was led by Professor Daisy Fancourt at the University College London and focused on the effect of social isolation on mental health. The methodology involved regular contact with participants to collect a range of psychosocial, behavioural and COVID-related data over time. HealthWise Wales was the main source of participants from Wales, with over 7,500 of our participants taking part, contributing to this study of over 70,000 participants across the UK. This slide shows that a number of analyses and publications have come out of this study already. So I hope that I've highlighted for you some of the benefits of having a research register of participants for providing rapid response research at scale in relation to the pandemic. I'll just summarise why HealthWise Wales may be instrumental in facilitating your research. HealthWise Wales has facilitated the recruitment of over 25,000 participants to COVID-19 research studies and unaccounted numbers to UK-wide initiatives. HealthWise Wales participants have shown strong commitment to COVID-19 research studies, which have included a range of methodologies. HealthWise Wales provides a vehicle for accessing rapid response funding. The HealthWise Wales platform facilitates linkage to healthcare data, which may be used to link healthcare behaviours to healthcare outcomes. In addition to advertising research projects, HealthWise Wales can facilitate public and patient involvement in both research and policy issues. To find out more about our research and how we may be able to support your research, visit our website, or contact us in these ways. Last but not least, we acknowledge our participants, stakeholders, collaborators and funders for making our work possible and valuable. Thank you.